Hello, and welcome to KTLN News. I'm Howard Tucker.
And I'm Diane Smith. In the wake of Colonel Gaddafi's death, the Libyans are rebelling to create a new nation free of corruption and oppression. They will need to restore war-torn towns and repair social and political infrastructure. They will need to find a way to mend the national psyche.
While the 6.4 million Libyans try to recover from 9 months of bloodshed, they also have to cope with the psychological aftermath of nearly 42 years of oppression, leaving some experts bracing for an overwhelming need of mental health services.
We will go to our foreign correspondent, Cheryl Williams, who is reporting live from Benghazi.
Hi, Cheryl. So tell us about the current state on the streets of Benghazi.
Hi, Diane. You can sense the exhaustion of the people. 331,000 people have been displaced. With me is Hassan, who was a local shop owner who lost his wife and store during the conflict. He is now a single parent trying to cope with PTSD while raising his son Mohammed. Hassan, you are one of the 12.4% of the Libyans that have PTSD. How have you been coping since the death of Gaddafi?
Well, before the revolution, I had ambitions, but now I'm really depressed. And I don't have the ambitions I had before. Even though healthcare is free for the people, the resources we need are not here. The psychiatric hospital is so busy I can't see a doctor.
And is it true that the people of Libya face stigma related to mental health?
Yes. In our Arab culture, mental illness is shunned upon. It is difficult for many to get treatment when it is not socially accepted.
Thank you for sharing, Hassan. Back to you, Diane. Joining us now is Dr. Ahmed. Dr. Ahmed is the head of the psychology department of Misrata University and has been trying to establish proper mental health care services in the city since the conflict has ceased. Thank you for taking the time to talk with us today.
I'm happy to be here, Howard.
Dr. Ahmed, can you explain the current mental health status of Libyans?
Well, Diane, there has been an influx of patients with anxiety, hopelessness, headaches, nightmares, and physical pain, which are all symptoms of post-traumatic stress disorders. We've also seen an increase in stress-induced miscarriages. Before the conflict, we used to see 7 to 10 new patients a day. Now it has been between 20 and 30.
That is a significant increase, almost tripling previous numbers.
It is, Diane. The ripple effect is even felt economically. Young men who used to earn an income before are now unable to work due to PTSD, disability, and substance abuse. They destroy themselves and their family. It is a vicious circle.
In your profession, how have you been combating these emerging issues?
Keeping up with the demand has been difficult. As you may know, there was not an extensive mental health service prior to conflict. We need to strengthen local capacity to respond to psychological needs.
Thank you, Dr. Ahmed. Good luck with the challenges ahead. In the hopes of staying ahead of a potential mental health crisis, non-governmental organizations like Doctors Without Borders and International Medical Corps are already taking steps to help the newly freed population recognize the problems it will have to face.
We will now speak with a Canadian nurse working with MSF who specializes in mental health. We will hear about her experience as a frontline healthcare worker in Libya. Hello, Sarah.
Hi, Diane.
Can you tell our viewers about the challenges you have been facing?
First of all, the ongoing conflict leads to restrictions of movements, which is decreased access to healthcare centers and many medical warehouses. We were not receiving the supplies needed, and we couldn't send the very sick to tertiary centers.
That sounds like an additional challenge on top of your daily operations. Have you made any progress to address the growing mental health needs?
MSF has opened additional mental health centers in Tripoli, the country's capital. There we have begun training local Libyan psychologists about the emotional consequences of conflict while also supervising their daily practice. The center treats people who have been affected by any form of violence, be it physical, psychological, sexual, or conflict-related.
We will now switch over to Nafusa, where Fatima, a researcher for the Ministry of Health, has begun a pilot project to establish long-term mental health and psychosocial interventions. Hello, Fatima.
Hello, Howard. The deployment of mobile mental health allows residents for the first time to access specialized mental health care.
What are your hopes for the future of mental health in Libya?
The Ministry of Health hopes that soon a new generation of mental health workers will be able to deal with the country's complex post-conflict needs. Already, an outpatient mental health center has been opened in Tripoli. The Ministry of Health and the National Center for Disease Control has launched a 4-year mental health strategy.
Libya's future is on a positive road to change. Thank you, Fatima.
There is hope. Thank you for tuning into KTLN News. I'm Howard Tucker.
I am Diane Smith. Good night, Canada.